The upper limb is a complex structure comprised of bones, joints, muscles, nerves, blood vessels, and other soft tissues. By studying upper limb anatomy, one gains knowledge about the bones and their articulations, the muscles and their attachments, the blood supply to the upper limb, the innervation of muscles and skin, and the functional relationships between various structures. Here are some key elements and structures involved in the study of upper limb anatomy. Bones. The upper limb consists of several bones, including the humerus, upper arm bone, radius and ulna, forearm bones, carpals, wrist bones, metacarpals, hand bones, and phalanges, finger bones. Understanding their anatomical features, joints, and movements is crucial. Joints. The upper limb has various joints that allow for movement and stability. Important joints include the shoulder joint, glenohumeral joint, elbow joint, humerulnar and humero-radial joints, radiocarpal joint, wrist joint, and various joints within the hand. Muscles. Numerous muscles are involved in moving and stabilizing the upper limb. These muscles can be categorized into groups such as shoulder muscles, forearm muscles, and hand muscles. Understanding their origin, insertion, action, and innervation is essential for comprehending upper limb movements. Nerves. The upper limb is innervated by a complex network of nerves. The brachial plexus is a major nerve network that gives rise to nerves supplying the upper limb, including the median nerve, ulnar nerve, radial nerve, and others. Knowledge of their course and distribution is important for understanding sensation and movement. Blood vessels. The upper limb has a rich blood supply provided by major arteries such as the subclavian artery, axillary artery, brachial artery, and their branches. Veins accompany these arteries and drain the blood back to the heart. Soft tissues. In addition to bones, muscles, nerves, and blood vessels, other soft tissues like ligaments, tendons, fascia, and skin are integral components of the upper limb. Ligaments provide stability to joints, tendons connect muscles to bones, fascia provides support, and skin covers and protects the structures. The upper limb consists of several bones that contribute to its structure and function. Here are the major bones of the upper limb, along with their functions, related diseases, common symptoms, causes, and treatments. 1. Humerus. The humerus is the bone of the upper arm. 1. It connects the scapula, shoulder blade, to the radius and ulna of the forearm. 1. It provides attachment sites for various muscles involved in arm movements. 1. Diseases. Common humerus-related conditions include fractures, breaks in the bone, dislocations, and osteomyelitis, bone infection. 2. Symptoms. Symptoms of a humerus fracture or dislocation may include severe pain, swelling, deformity, limited range of motion, and difficulty moving the arm. 3. Causes. Humerus fractures can result from trauma, falls, or direct blows to the arm. 3. Dislocations can occur from sudden impact or forceful twisting of the arm. 4. Treatment. Treatment options vary depending on the severity of the injury. 4. They can include immobilization with a cast or splint, realignment of the bone fragments, surgical fixation with pins, plates, or screws, and physical therapy for rehabilitation. 1. Radius and ulna. The radius and ulna are the bones of the forearm. 1. The radius is on the thumb side, and the ulna is on the little finger side. 1. These bones enable forearm rotation and wrist movements. 1. Diseases. Common conditions affecting the radius and ulna include fractures, osteoarthritis, and tendonitis, inflammation of tendons. 2. Symptoms. Symptoms of forearm fractures include pain, swelling, deformity, difficulty moving the forearm or wrist, and tenderness. 2. Osteoarthritis can cause joint pain, stiffness, and reduced range of motion. 3. Causes. Fractures can result from falls, sports injuries, or direct trauma to the forearm. 3. Osteoarthritis can develop over time due to wear and tear on the joint surfaces. 4. Treatment. Treatment options for fractures may involve immobilization with a cast, realignment of bone fragments, and surgery for complex fractures. 4. Osteoarthritis management may include pain medications, physical therapy, assistive devices, and, in severe cases, joint replacement surgery. 1. Carpals. The carpal bones are the small bones of the wrist. 1. They form the wrist joint and allow for wrist movements. 1. Diseases. Carpal bones can be affected by fractures, dislocations, and conditions such as carpal tunnel syndrome and arthritis. 2. Symptoms. Symptoms of carpal fractures or dislocations include wrist pain, swelling, deformity, and limited wrist movement. 2. Carpal tunnel syndrome can cause pain, numbness, tingling, and weakness in the hand and fingers. 3. Causes. Fractures and dislocations can result from falls, direct trauma, or repetitive stress. 3. Carpal tunnel syndrome can be caused by compression of the median nerve in the wrist. 4. Treatment. Treatment options depend on the specific condition. 4. They can include immobilization with a splint or cast, realignment of bones, surgical intervention, pain management, and physical therapy. 1. Metacarpals and phalanges. The metacarpals are the bones of the hand, and the phalanges are the finger bones. 1. They provide support and flexibility to the hand and fingers. 1. Diseases. Metacarpal and phalangeal fractures, dislocations, and conditions such as osteoarthritis and trigger finger can affect these bones. 2. Symptoms. Fractures and dislocations may cause pain, swelling, deformity, and difficulty moving the hand or fingers. 2. Osteoarthritis can result in joint pain and stiffness. 2. Trigger finger can cause finger locking and pain during movement. 3. Causes. Fractures and dislocations can occur due to falls, crush injuries, or excessive force on the hand or fingers. 3. Osteoarthritis can develop over time, while trigger finger can be caused by inflammation or thickening of the tendons. 4. Treatment. Treatment options may include immobilization, realignment, splinting, surgery, pain management, and hand therapy.